Improving patient experience with e-prescribing. E-prescribing not only benefits healthcare providers and pharmacies, but also significantly improves the patient experience. By enhancing the convenience, safety, and accessibility of prescriptions, e-prescribing contributes to higher levels of patient satisfaction and aligns with patient-centered care models. 1. How e-prescribing enhances patient satisfaction and convenience. Patients today expect healthcare services to be streamlined, efficient, and accessible. E-prescribing helps meet these expectations by improving the medication process in several key ways. 1.1. Faster and more efficient prescriptions. Problem: traditional paper prescriptions can take time to process and may require patients to wait in long pharmacy lines or revisit the healthcare provider for prescription renewals. Solution: e-prescribing speeds up the entire process. Prescriptions are sent electronically directly to the pharmacy, eliminating the need for patients to wait for paper prescriptions or return to the clinic for refills. This increases convenience and reduces wait times for patients, enhancing their overall satisfaction with their healthcare experience. 1.2. Reduced prescription errors and delays. Problem: paper prescriptions are susceptible to errors, such as illegible handwriting or lost documents, leading to delays or incorrect medications being dispensed. Solution: e-prescribing eliminates these issues by ensuring that prescriptions are clear, accurate, and transmitted directly to the pharmacy. Automated checks for drug interactions, allergies, and dosages further reduce the risk of errors, which leads to better patient outcomes and greater peace of mind for patients. 1.3. Medication. Availability and access. Problem: patients may experience delays in obtaining medications if the pharmacy is out of stock or if there are issues with prescription verification. Solution: e-prescribing allows pharmacies to access the prescription in real time, enabling them to check availability and notify patients if a medication is out of stock or needs to be substituted. Patients can be informed quickly about any changes, and they can be given the option to choose another pharmacy or a different medication, improving their access to medications. 1.4. Convenience of prescription. Refills. Problem: managing prescription refills through traditional methods can be cumbersome, often requiring a phone call to the doctor's office or visits to the clinic. Solution: e-prescribing systems make it easier for patients to request refills. Refills can be authorized electronically, and pharmacies are notified instantly, reducing the need for unnecessary appointments or calls. This is especially beneficial for patients on long-term medications, such as for chronic conditions, providing them with seamless access to their medications. Second, e-prescribing as part of a broader patient-centered care model. E-prescribing is a critical component of the patient-centered care model, which focuses on providing care that is respectful of and responsive to individual patient preferences, needs, and values. It enhances the patient-provider relationship by fostering collaboration, improving communication, and ensuring that patients are actively engaged in their treatment plans. 2.1. Facilitating personalized care. Problem: in a traditional care setting, patients may face delays in receiving medications, especially when care is fragmented between multiple providers or specialists. Solution: e-prescribing helps create a more coordinated care environment by allowing all providers, e.g., specialists, primary care physicians, and pharmacists, to access a unified medication list. This collaboration leads to better tailored care plans, ensuring that medications prescribed align with the patient's overall health needs, and that patients are not over-medicated or prescribed conflicting drugs. 2.2. Empowering patients to be more involved in their care. Problem. Many patients feel disconnected from the decision-making process regarding their treatment, which can affect their satisfaction and adherence to prescribed therapies. Solution. E-prescribing systems can include features such as automatic updates on the status of prescriptions, including approvals, availability, and any changes to the treatment plan. This empowers patients by keeping them informed and involved in their treatment process, thus fostering a sense of partnership in their care. Additionally, patients can review their prescribed medications and treatment options in real time, which can lead to better adherence and greater trust in their healthcare providers. 2.3. Improving continuity of care. Problem. When patients switch providers or see multiple healthcare professionals, their medication records may not be properly updated, leading to gaps in care. Solution. E-prescribing supports continuity of care by maintaining an up-to-date and comprehensive record of a patient's medications. This reduces the likelihood of medication errors during transitions between care providers, whether during hospital discharges, referrals, or specialist visits. It also enhances the ability of healthcare providers to monitor the patient's progress and make adjustments to their medication regimen as needed. 3. Educating patients on how to use digital prescriptions. For patients to fully benefit from e-prescribing, they must understand how the process works and how they can utilize it effectively. Patient education is key to ensuring the successful adoption of e-prescribing. Explaining the e-prescribing process. Problem. Some patients may be unfamiliar with e-prescribing or may be apprehensive about using digital tools, fearing they will complicate the medication process or lead to errors. Solution. Healthcare providers should take the time to explain how e-prescribing works during patient visits. This includes clarifying how prescriptions are sent directly to the pharmacy, how patients will receive notifications, and how they can track the status of their medications. Providing written instructions or resources about e-prescribing can also help patients better understand and feel more comfortable with the technology. 3.2. Addressing common concerns. Problem. Patients may have concerns about the security and privacy of their health data, especially in the digital age. Solution. Healthcare providers and pharmacies should reassure patients that e-prescribing systems comply with privacy regulations, such as HIPAA, and utilize encryption to protect their data. Informing patients about the security measures in place will help alleviate concerns and encourage trust in the system. 3.3. Providing assistance for technology access. Problem. Not all patients have equal access to technology or may be unsure how to navigate digital systems. Solution. Healthcare providers can offer assistance or resources to help patients who may be less familiar with digital tools. For example, clinics could offer tutorials on how to use e-prescribing apps, or pharmacies could guide patients on how to check their prescriptions online. For those without internet access, providers can help set up alternative communication methods, ensuring that all patients benefit from the advantages of e-prescribing. 3.4. Patient engagement and support. Problem. Patients may face challenges in understanding or managing multiple prescriptions. Solution. E-prescribing systems that offer features like medication reminders, dosage instructions, and drug interaction alerts can further support patients in managing their medications. Providers can also encourage patients to use apps or tools that track medications, improving adherence and making it easier for patients to follow their treatment plans. The future of e-prescribing. E-prescribing has evolved significantly over the past few years, and as healthcare technology continues to advance, its future holds even more potential. Innovations such as artificial intelligence, AI, blockchain, and next-gen software, as well as the expansion of e-prescribing and telemedicine, will significantly shape the landscape of healthcare delivery. The global adoption of e-prescribing will likely enhance the efficiency, safety, and accessibility of prescriptions worldwide, further transforming patient care. 1. Innovations in e-prescribing, AI, blockchain, and next-gen software. 1.1. Artificial intelligence, AI, in e-prescribing, AI-driven decision. Support. One of the most exciting innovations in e-prescribing is the integration of AI-powered clinical decision support systems, CDSS. AI can analyze vast amounts of patient data, including medical history, genetic information, and current health status, to recommend the most appropriate medications and dosages. This real-time, personalized decision-making process enhances prescribing accuracy, reduces the risk of adverse drug reactions, and promotes better patient outcomes. Predictive analytics for medication management. AI can also be used to predict medication-related issues, such as identifying patients at risk for non-adherence or medication overuse. By flagging these issues early, AI can help providers intervene before problems arise, improving patient safety and medication efficacy. Voice recognition and automation. AI tools with natural language processing, NLP, and voice recognition can assist healthcare providers in quickly creating prescriptions by dictating medication orders directly into the system. This automation reduces administrative burden and allows providers to focus more on patient care.